So here I'm going to be talking about the carbon footprint of healthcare and approaches we might take to mitigate that carbon cost. So just to put this in context, the carbon footprint of the NHS has been estimated at around 4.5% of the total for the UK. And that's been found for health systems across most high income settings, except the US, where it's estimated to be nearly double that. So just some caveats to this. Carbon is not everything we should talk about. There are other harms, of course, from healthcare. For example, environmental pollution from things such as microplastics, which have been found at very high levels in the operating theatre. We have so much material. Things such as toxic compounds such as DEHP, which are used to soften plastics and are found in high levels in wastewater out of a hospital in Denmark. And also labour risk harm, which I'm going to talk about in a different lecture related to our supply chain. However, carbon is the most common metric we use because it is the main gas that is causing global warming. And the NHS has usefully produced this carbon wheel, which tells us where the breakdown of the carbon into the NHS is. And that's estimated upon financial spend data. So when we look at this carbon wheel, when we're looking at the whole system, we might think, well, where can we reduce things? And again, we can pick off things from this carbon wheel and say this is where we could take things down and change things. And all of that's important, but we should also not forget, let's step back and say, hang on, what if we didn't deliver that care in the first place? So public health approaches are really important as well. Healthy lives stop us getting ill and stop us needing healthcare in the first place. And for example, in surgical care, myself being a surgeon, being an area of interest, reducing obesity will reduce the amount of gallbladder disease you get and osteoarthritis of the lower limbs from being overweight, for example. Healthier diets may reduce bowel cancer. Of course, stopping smoking will reduce many of the cancers of the upper aerodigestive tract and lungs that we may see. But when looking in the health system, how can we go around this carbon wheel? And so one of the first things we might think about is things like our estates, which is where a lot of people traditionally thought this agenda was how our buildings are built. And of course we need green electricity. Of course we need better insulated buildings because many of our buildings are really old. And of course we need to embrace things like LED lighting. But the components that we're going to change there are relatively small compared to the total carbon of the health system. And so we really need clinical engagement. This isn't just about estate, about the way we deliver care. Often people think it's all about waste and gosh, we produce so much waste. And indeed we do. But it's not about waste segregation and recycling as the absolute answer to everything. It is important, we should recycle wherever we can, but we know that in healthcare that's quite difficult because waste may be contaminated, it may be made of multiple different materials, and in reality recycling is difficult. But recycling also only recovers a small proportion of the carbon footprint. Typically with home recycling it might be 4 or 5% of the carbon, so we're not going to recycle our way out of this crisis. So it's part of the solution, but largely it's a distraction from other things, is stopping us using things in the first place or reusing wherever we can. There are some particularly toxic gases that are released, particularly during anaesthesia. So desflurane is an anaesthetic gas that has around 3,000 times the global warming potential of carbon dioxide. And certainly NHS in England has now said that it will be effectively decommissioned, banned from early 2024. We hope that other health systems will follow suit because this gas should no longer be used. There are other gases like nitrous oxide, which has 300 times the global warming potential, and that also we need to reduce and capture that and not release it into our atmosphere, and also stop leaks of that gas, which are quite widespread. And then we've got this agenda related to travel. So we've got patient transport, staff transport, and business-related transport. And all of that is largely at the moment fossil fuel based. And so where we can reduce that transport, that's the best solution. And where we can't reduce transport, move to greener transport options, such as cycling, walking, public transport. Particularly for patients, remote consultation is an important part because we know that the main component of the carbon footprint of a consultation is the patient's journey to get to you. So here's a review looking at the carbon footprint of a remote consultation. And here you can see the distance travelled is directly proportional to the estimated carbon. So rather than saying we won't do remote consultation because there are some clinical challenges, what we need to do is say, where could we do this? That might be context specific. So for example, if I'm going to see a new patient with an ear problem, obviously I can't examine the ear remotely at the moment. so I will need to bring them in. But some of the follow-up consultations, for example, that's possible. For some conditions, such as patients with recurrent tonsillitis, I can actually assess them remotely. And that needs to be part of the solution. We embrace it wherever we possibly can. But a large part of the carbon footprint of the health system is actually what's here in the blue, and that is our supply chain, everything that we're buying in to deliver healthcare. And the medical supply chain is a particular interest of our group. But it's more than that. It includes, look at the carbon 20% due to what we prescribe. And so we need to de-prescribe where possible. When medicines are of no real benefit, that's going to help our patients as well as reduce our carbon footprint. And some particular medications, in particular inhalers used for airway disease, the propellants are particularly toxic, and so we need to move from metered dose gas propellant inhalers to dry powder inhalers wherever possible. There are other things we can do. We can, non-medical equipment, we can move to digitization so we don't use so much paper, of course. We can repair equipment wherever possible. And other things that we're procuring, we need to move to lower carbon diets, which have less meat in particular within them. And then a particular area of interest is the reduce and reuse of medical equipment. And we'll be talking about that in some of the other lectures that we're giving here, and how we enable that, which is something that we all care about, because those of us who work in health systems see the incredible amount of waste that is generated. And so to finish, just to remind us of the hierarchy, it is about reducing where we can. And for example, I know that people think, well, what effect can I have? But even the most junior staff in a healthcare environment can have a real effect. For example, there's been studies showing that around a quarter of all cannulas put into patients in accident and emergency are not used. So let's think, did I need to do that in the first place, or is it just the culture? We know that around 2/3 of gloves that people wear are completely clinically unnecessary. People put them on because it's become the culture to put them on, rather than thinking, I need to wear gloves only when I'm potentially in contact with infected bodily fluids. That's something that the most junior of us can do. And we also needed more senior people to think about where I can reduce and reuse. Reuse, why is that part of the agenda? You'll hear elsewhere that when we reuse medical equipment, we typically save between 1/3 and 1/2 of the carbon footprint. So that's going to have a much bigger effect than that final thing, recycling, which will have a small carbon footprint, typically 4 or 5%. So let's reduce healthcare need as well. Let's reduce the number of consultations that people come into, and let's also reduce and reuse some of the equipment we use.